Hey there. Okay, so I wanted to talk through asthma in preschoolers because this is a common question, concern, thing that parents struggle with. And honestly, a lot of the current practices are based on things that were taught and told like 20, 30 years ago, and are not up to date and actually can do some actual harm that I'm going to talk through here. Actually, I'm going to flip to that first. What we know is that undiagnosed asthma can cause long-term, lifelong morbidity when it comes to our lung development. So here, this is a Diagnosis and Management of Asthma in Preschoolers, a Canadian Thoracic Society and Pediatric Society position paper. One of the things they say is that wheezing in early life has been associated with reduced lung function at 6 years of age that generally persists into adulthood. Airway remodeling and irreversible damage to the airways has been documented in toddlers and may explain altered lung function trajectory. So missing asthma and not treating them appropriately, or just saying you have reactive airway disease, here's your albuterol, they're going to cough, or they just have allergies, or we can't diagnose asthma until they're 6 years old, all those things are false, and they can do long-term harm. So in this paper, which is from 2015, so this isn't like brand new information or anything like this, they talk first and foremost about how asthma often starts before 6 years of age. Most children that have asthma, it starts in the preschool years. Sometimes there's a family history, sometimes they had some sort of lung insult, like they were born prematurely, or they had RSV at a young age. Those are the things that increase the risk. And because people are told you can't have asthma until you're 5 or 6, then it delays treatment and it can be associated with short-term and long-term morbidity. The way that we diagnose it, so when people think about asthma, they often think about like breathing into the spirometer tube and then seeing those lung function graphs that look kind of like this. In children, we can't do that reliably. But that's okay. We don't have to do that in order to diagnose asthma. So what we see here is that the diagnosis of asthma should be considered if they have in their 1 to 5 years of age with frequent asthma-like symptoms or recurrent exacerbations with asthma-like signs. And what we typically see is reversibility, meaning that we give them asthma medications and they get better. So we give them bronchodilators like albuterol, we give them steroids like prednisolone or prednisone or Decadron, and they get better. And the characteristic feature is wheezing, which is difficulty with expiration, loud, noisy expiration. And so this paper lays out why we should diagnose asthma in preschoolers and how to do it effectively. Most children with asthma experience the symptom onset in the preschool years, and early diagnosis is important to avoid treatment delay, reduce morbidity, and maximize lung growth and function. So then this paper just goes through and talks about the different things that when it comes to asthma, such as airflow obstruction, and the reversibility. So airflow obstruction means wheezing, which looks like musical, loud, expiratory noises. Air has difficulty getting out of the lungs, and then a chronic cough can develop as well. And then reversibility. We give them asthma medications, and their symptoms of airway obstruction improve. Now, one of the things that it says here is that asthma usually starts in toddlers, and the best way to distinguish, so one of the things that can make it difficult is recurrent respiratory infections or bronchiolitis that babies get with RSV or those sorts of things. We can make the diagnosis by the response to asthma medications. Things like bronchiolitis, when you have RSV or another respiratory infection that causes wheezing, don't typically improve with bronchodilators like albuterol, even though they get prescribed quite a bit, or with steroids, even though they get prescribed quite a bit, they just get better on their own. Now, when we look at the rest of this paper, it kind of goes through a lot of the very specific things, like for alternate diagnoses of asthma, it makes this really nice, easy to follow table that you can use to decide if your child has asthma. You just have to go down one of these pipelines. This is really something for your doctor, not that you have to get into. But then some of the key messages in here is that in children 1 to 5 years of age with recurrent episodes of asthma-like symptoms and wheezing, if we have improvement with inhaled bronchodilators, with or without steroids by a physician, that's a sign of asthma. And if we have those, then what we should do is a therapeutic trial with a medium-dosed inhaled corticosteroid to see if we can get benefit. Now, what steroids do, okay, the rest of this I didn't highlight a lot because it just kind of gets into the approach to management, which includes non-pharmacological things like minimizing smoke exposure, making sure that they're using their devices appropriately in terms of like spacers and masks and those sorts of things. And then the pharmacological approach, which I didn't highlight, but I will highlight now, inhaled corticosteroids taken every day at the lowest effective dose, is the preferred first-line management for children with persistent symptoms. These steroids help to decrease the reactivity of the lungs and make the lungs more tolerant of respiratory infections, allergens, those sorts of things. So they're not as reactive. They don't get prone to wheezing quite as quickly. So hopefully this has been helpful for you. We have an asthma program in our office where we're able to do spirometry in children that are of age, but in younger children, we're able to make that diagnosis to help protect their lungs and make sure that we're doing everything that we can to set them up for success in life when it comes to their respiratory function. So we take a very proactive approach. We minimize medications, but we take the diagnosis seriously, and we don't delay the diagnosis because of old rules of thumb that you have to wait a certain number of years, or we don't want to make the diagnosis because of insurance or military qualifications. Those things aren't concerns anymore. That's just kind of an old adage that's not true for many years now. And so if that's something that you're looking for, if you're looking for help with your child's breathing, respiratory issues, asthma, allergies, those sorts of things, check out our website. We do visits for members of our clinic and for non-members so that we can help everybody to maximize children's enjoyment of those toddler years, which includes not having asthma when you don't need it.